I'll never forget calling my mum and just saying to her, sorry, you can't come along with me. And she was very, very upset. She was distressed on the phone. It's my first child, and I regard myself as a young mum, I suppose. I was only 27. The restrictions affected my birth from the very beginning. My husband wasn't able to wheel my suitcase into the room with me. When I got into the room, I was in a room by myself. So immediately I thought, why can't my husband be with me if I'm in an isolated room anyway? Because I was induced, I was there for 6 days by myself. When it came to the active labour stage, I was told from that bullet point on the website, your partner can be called now. They didn't call my partner, so that was quite distressing. It was at least 8 hours into the active labour stage when they called him. It didn't seem real, actually. The whole experience didn't seem real. My daughter had to get checked over, the kind of standard newborn checks. And the moment my husband came back down into the recovery area, he was told he had to go home straight away. So it affected us as a family dramatically. I was high risk to an extent where I was on crutches when I was in the later stages of pregnancy, and I knew I'd still have to use the crutches for a few weeks after. So I was in that ward hobbling around with my baby, crutch on one hand. I had to leave my daughter in the ward when I went to go to the bathroom, when I went to go to the shower. The COVID-19 pandemic has affected me dramatically. I'm not fond of doing anything by myself with my daughter. I'm capable of doing things by myself with my daughter, but even just going to the park, I'm always like, okay, my husband, can you come with me? Any appointments, even if it's just a little cough, a little temperature, can you come with me? I have found that I have nightmares sometimes about being by myself, and then sometimes it's not actually just about labour. It's not just about labour. It's just in general doing things by myself. I think it is absolutely paramount that midwives and maternity care listen to mothers. We are not all the same. We haven't all got the same complaints. And I believe if just a little more time is spent on listening to mothers under maternity care, then I do believe the NHS would really improve with the care that they're able to offer mothers.